I had an injury and I was interested in a holistic approach, and I didn't want to have surgery. So I was looking for somebody that had that mindset. So prior to this, I had seen just a standard orthopedist for my left shoulder, and he put me on Advil for 2 weeks, and then the pain went away. So he was like, "You're good to go." And then the pain came back and I wasn't any better. Dr. Chris actually suspects that I have a partial labrum tear in the left shoulder, and I absolutely did not want to have surgery if I didn't have to. So I was really pleased with the treatment and being able to avoid having surgery, and that the pain has not come back at all. I wasn't really skeptical, but I was very curious because it was something that I hadn't heard of, and I just didn't know if it was going to work or not. But I came in with an open mind, and that really, I think, helped.
Heather's been coming to us for about 6 or 7 years now. At this point, we've seen her so many times that she's become a friend of mine. The coolest thing to me about Heather's process is, as somebody who's very fit and does CrossFit, is anytime she has an injury, and she'll even put off coming to see us for a few weeks or for a few months, whether it was her shoulder labrum or the disc in her low back or her calf or her ankle, whenever she comes back in, she is usually pleasantly surprised that she's finding the relief that she needs, and she's able to get back to her CrossFit and her fitness.
I've had different pains throughout the years. I've been going to Barefoot Rehab for probably about 6 years or so, on and off, as things come up, and then they get resolved, and I go off for a few months, and then I come back if something else pops up.
We were just talking to her last week, and she was saying, "You know what, I'm going to be coming to see you forever because I don't ever plan to stop working out, and I just need to take care of my body." So that's the coolest thing about what we do here, is that people are really able to continue doing the activities they love to do when they just allow us to help them by maintaining the adhesion out of their body so that their muscles stay strong and healthy.
Yeah, so I believe that just movement brought my injury about. I happened to be exercising when I was doing that movement, and I started to give it rest. It didn't go away, and then I was looking at traditional chiropractor. It wasn't really helping, and then that's when I did a search and found Barefoot Rehab.
So my patient Heather came to me this past November because she couldn't work out anymore due to some really intense pain and soreness in her right shoulder that was just not going away no matter what she did. And she is a high-level, fitness athlete in her own right, and so not being able to work out was definitely a problem. So she came to me and we did an exam and we checked her ranges of motion, and we found that her shoulders were just not functioning really well. So we went ahead and checked her for this adhesion stuff, the sticky glue-like material that, is the most common cause of chronic muscle pain that pretty much no doctors really ever talk about. And she had a decent amount of adhesion.
So with Dr. Nina, she treated my right shoulder. I wasn't necessarily in pain, but I could just feel that something wasn't quite right anytime I was overhead, whether it was pressing or jerk or snatch or trying to do handstand holds. For me, there was just something there that felt a little off, and I wanted to be preventative, so I started seeing her. And it was, when I put my arm up, it felt like something was pulling my arm down, and I just had a little bit of sensation in the front of my shoulder.
So after it was about 5 treatments actually, she was already 50% better and had been able to go back to working out every day without provoking or increasing her pain. And after just 7 visits, she was 80% better.
After the first treatment, that went away. And then seeing her on a consistent basis, it just got less and less and less. And now I'm able to do all of those movements without any pain or any sensation. There had definitely been a number of treatments that when I came in, I had really bad pain, and by the time I left after that treatment, my pain was less. And then the next day, my pain was less than it normally was. So when I had that for the first time, that's when I knew this was working and it was for me.
Heather started coming to the clinic a month ago for low back treatment, and she was having pains while working out and exercising, and we were able to get her back up and running, and she's been experiencing less pain, and she's been performing at the level she wanted. So that's a big win for us.
Anybody that has pain and wants to avoid surgery, and you do a basic assessment, and then they'll be able to tell you if they can help you or not. So as far as who should go, anyone, because it doesn't hurt to just go have that consultation and get the feedback as far as if they can help you or not. You can really only get improvement.